As I come into my PrognoCIS dashboard, I see the patients that I have scheduled today. One of the very nice features of PrognoCIS is that your patients can actually do a lot of the work for you. For example, here I have a new patient, Jane Darden, coming in for a rapid heartbeat, and she has already arrived. She's been taken to room number 6. I can see that she's going to need a taxi after her appointment, so all of the nice information is there. You'll notice the little red icon to the left of the patient's name. That means that she's filled out a form online. So I can really take advantage of that. She's done that via the patient portal. When I come into her chart, you'll notice everything in terms of her allergies, her meds, past medical history is all pretty much blank. There's nothing there other than some health maintenance items that are due based on her gender, her age. I'm going to choose patient form from the left-hand side. And it could have been the patient who did this, or it could have been a facility that she works at. As I come into the patient form, you'll notice that these customized forms allow the patient to indicate their allergies, their current medications that they're taking, their surgeries they've had. And she may bring up something else. She just remembered that she had a sinus surgery, and that was back in 2005, she thinks. She doesn't remember who the doctor or the hospital was, but at least we get that captured. Her past medical history, she's had a history of asthma since her teens, heartburn. So I review this with the patient, and anything she suddenly remembers that is maybe different, whether it be on her social history or review of systems, she suddenly mentions that she's got ringing in her ears, I can update that. You'll see down at the bottom I have a save button, and I also have an accept button. So that allows me to accept that information, and at the top it now says encounter updated. When I go back to the face sheet, notice all of that information has been nicely read into each of the appropriate windows. So this is coming in as discrete data and is already starting to populate the progress note. I can still come in here if she remembers another surgery or anything else about her family history, I can do that. But maybe the next thing I'd like to do is just come in and maybe take some vital signs. So we can come in here and put in what is her vitals for today. And it's going to automatically calculate, of course, the things like the BMI, what's her respiration, her pulse, what's her respiration, her BP. And we do also work with Welch Allyn machines, so you can take that information. Next, notice the green arrow at the bottom right allows me to move on to the HPI. And here it pulls up a list of all the different reasons patients come to see us. From the schedule that we saw, it says she's here for rapid heartbeat. So I can say, okay, well, is it that, or is it chest pain? Maybe she suddenly started to also have some headaches. So we can quickly pull those up. I've got a nice template here regarding arrhythmia, palpitations, but I can always come down to the bottom. If I would just like to quickly jot some notes, I can do that. But the template's very easy to configure exactly the way that you like to do your work, and you can customize them right on the fly. If I come to the headache, notice I've got a nice set of questions. I could check these all off with the defaults, or I could come down to the bottom if I wanted to just put my notes or do voice recognition. Notice that I can have nice multi-select fields in case that patient is having multiple areas being affected. We can say it's getting significantly worse. The frequency has been about 4 times a day, and I can just move on. As I come here to the review of systems, notice I can see those positives that she marked on the form. If everything else she says is fine, I can quickly mark those, but maybe she does bring up something else. She says she has, she would term it as migraines that she's had before. We can quickly mark that and then just move on. So your workflow arrows can really set you up exactly the way that you want to go, the way that you like to do your work, and you can quickly get those things done. This information is being combined with what she filled in on the form. So if I go to look at the progress note here, you'll see we've got this nice note that talks about the arrhythmia, the headache, all her past medical history, family history that she put in is all nicely there. I can see those positives in red. Now I'd like to just go do my assessment. As I come to the assessment, I can see the cardiac dysrhythmia ICD-10 code has already been nicely chosen for me, as well as the headache one. If I don't agree with that, I can always jump in to my preferreds, or I can choose additional codes if I would like. So you can really get exactly what you need. You can do a detailed drill down if you need to look for specific codes. Notice that for my arrhythmia, I have specific ways that I might like to deal with that, but I can always edit that. I can change something else. I can do a prescription. I can choose to order something. So it really allows me to quickly capture that information from the portal, and get on with my note and be done with